Thank you. I promise I will wrap up and comment less in 10 minutes, less than in 10 minutes. In all lectures, we memorize that advanced technology, personalized care is personalized, and more patient involvement is succeed in last decade. And also we learned that emerging technologies in next decade, we will face emerging technologies such as nanomedicine, stem cells more frequently, and biomarkers will be helpful for early diagnosis. But patient focus and financially sustaining and delivery of care is critical issues, and education and training will be very important. The major problems faced by developing countries are poverty, malnutrition, violence, limited access to care, the high burden of communicable diseases. And we can add to these in developing countries, trauma due to traffic accidents and earthquakes. The lack of adequate healthcare personnel and increasing cost of medical care are very critical issues in developing countries. The lack of adequate healthcare personnel in quantity and quality causes physicians to examine their patients, too many patients in a short time, and the lack of insufficient dialogue between patients and physicians causes malpractice and dissatisfaction of patients. International efforts to control the spread and treatment for communicable diseases has resulted in the development of infrastructure and trained health personnel. Similar efforts are necessary on non-communicable diseases, including musculoskeletal diseases such as osteoarthritis and osteoporosis. Patient-centered care is an important driver for many national health systems in Europe. Communication between patients and caregivers, including interactional dialogue, listening, are very important. Shared decision-making, patient education, and self-managed programs are very critical. The dialogue between patients and doctors is not important not only for patients but also for physicians for accurate diagnosis and proper treatment. More patient-reported outcomes should guide shared decision-making in clinical practice. In summary, in the last decade, you must focus on cost-effective treatment, training healthcare professionals. Training must be patient-centered, as mentioned in the last lecture, and we must tell to our students and residents, do not treat X-rays and MRs, but treat the patients. Training, also educating patients are very important, and developing self-management programs will facilitate prevention. Thank you.